The motion picture you're about to see could have been made in any hospital in the world where agonizing decisions are faced by parents, by clergymen and doctors and lawyers every day. In this film, Johns Hopkins Hospital, one of the great mentors of the world, was willing to present one such problem candidly. Breathtaking discoveries of modern medicine force new and torturous moral decisions upon us all. The Joseph P. Kennedy Jr. Foundation made this film to help us face up to those decisions with courage and knowledge and compassion while there is still time. Thank you.
The time, September 9th, 1971. The people, Dr. Renee Fox, Professor of Sociology. Dr. William Curran, Professor of Legal Medicine. Dr. Robert Cook, Professor of Pediatrics. Dr. John Fletcher, President of Intermet Seminary. Mrs. Sidney Callahan, psychologist and author. Few subjects are common to the professional lives of all these people. They are here to watch and discuss a film which deals with one of these, the subject of life itself.
That's it. I'll go call the parents. He looked very much like a child that you would have found abandoned somewhere and left to die in a garbage can. I can remember the parents and the decision and my agony, and I knew that I was partly responsible.
That's a good push.
That's terrific.
Let's have another one. Now you relax for a minute while we listen to the baby's heart.
+2.
Good girl. Keep at it.
When? No, it hurts. Okay.
Good girl.
Here it comes. Okay, now we'll get the shoulder. Good.
Okay, baby. Come on. Let's fuss a little.
Sure is a boy.
Dr. Villafani, is the mother awake?
No, she's up.
This baby looks a little mongoloid to me.
The diagnosis of Mongolism can be made with a fair degree of certainty in the nursery. In addition to the Mongolism, the patient had this disorder called duodenal atresia. There was no opening between the stomach and the lower intestine.
A child with duodenal atresia doesn't look to be any...
Dr. Haller knows a good deal about Mongolism and has operated on many Mongols with problems. Doing fine. He's well hydrated, and we have an IV in, and the NG tube is in. And
So as far as you're concerned, we're all set to go in the morning.
right.
There's some possibility that they are not going to want an operative procedure on that baby. She's a nurse and apparently has taken care of some children who were Mongols in the past and has some real serious reservations. But
The presence of a lesion that was incompatible with life allowed them to make the decision about whether they not only wanted their Mongol child, but whether they wanted their Mongol child to live or die. The child's life, if you look at a Mongol's life, was not one of pain, or suffering, or misery, or that he would never learn, or that he would never know himself, or that he would never be an individual. His life, although certainly not normal, would be a life. I mean, he would be a living human being.
Making an opening so that the contents can go through all right. And so as you can see, it's a relatively simple operation, but it's in a fairly small baby. And
Dr. Haller wanted to operate on this patient. He did tell the parents, however, that it would be their decision.
But the operation will have no effect whatsoever on his underlying Mongolism, because this is a condition which is separate from, although it may be related to, the abnormality in his intestine. The Mongolism condition is not going to be changed by fixing his intestinal obstruction.
From the parents' standpoint, they were looking forward to having this bouncing, happy, healthy baby, and then some physician tells them that their child is a Mongol. Why burden ourselves? Why burden society? Why burden everybody with this defective child? Why not simply let God's will be done? The parents don't want any operative procedure to be done on the baby. And Dr. Haller has decided to respect their opinion and their belief about what they want done for the child. So we're going to stop any artificial means of prolonging the baby's life. It was a long and agonizing wait. I actually tried very hard to avoid going in and seeing the baby. And if I did look at him, I tried excruciatingly hard not to touch him, because it was very difficult for me to handle him, even to examine him. I was very concerned about what this was going to do to the nurses. Their initial reaction was one of just kind of horror and disbelief that we were going to do this. We were going to take a baby who was completely healthy baby compared to a lot of the patients they were taking care of on the floor, who was now going to go into a bassinet in some dark corner and starve to death. It's Dr. Bartholomew. I talked to the father several times. He would call and say, how are things? Meaning, is the kid still alive? By deteriorating, I felt uncomfortable talking to him, and I felt a little funny saying, well, things are working out, they're just taking a little slower. It took 15 days for the baby to become severely enough dehydrated that he finally died. That was an awful long time.
Wow. It really tears me up, you know. That's my first reaction to seeing it. That's one of the toughest things I've ever seen people have to face. But the film didn't tell you much about the kind of Mongolism the baby had, but it's going to take me a minute or two to...
I don't really understand why that would make any difference to you, what kind of Mongolism he had.
Well, what I'm aware of right now is two tremendous forces pulling against one another. One is that if a baby is born, you ought to do everything you can to preserve its life. That's what it seemed to me the doctor was reacting out of. The other is a recognition of the severity of genetic diseases. And respecting the power of that disease and wanting to act in the face of it, act responsibly as a parent, is the other thing. Yes, I would feel, to answer your question, I would feel less tense if I knew it was a very serious genetic disease.
It makes me angry. Here's a child who is as normal as any other baby almost, except it has a different future. It has a potential which is different, and somehow that changes the ball game completely. And it's very hard taking care of a baby like this, particularly when you see such a different outcome in so many instances. I've seen mongoloid children who have been the major source of comfort and pleasure of a family, and others where it's been a destructive force in a family, and they've had a good deal of unhappiness as a result. But it seems so difficult to be able to predict what the situation's going to be at a time when you have a newborn baby. And our society seems awfully unwilling to seem to help us out of this kind of a jam.
I think it's heartbreakingly moving to see this problem presented with a newborn child and presumably young parents, but it's not unique to this particular situation, the kind of problem with which the family on the one hand and the medical team on the other hand is faced. The physician has a very special kind of job to do, which involves, among other things, the ushering in of life and the ushering out of life.
Now that's a very neutral word, ushering out, as though this child had to die, and therefore he was just helping it, or he could have helped it along a little more in this sense. But that was a child that did not have to die. But what worries me is the fact that the parents were allowed to make this decision, as though that baby belonged to the parents. Now that, to me, is the key problem. Who do babies belong to? Do they belong to the parents? Does the parent have the right to say this baby will live or this baby will die?
Doesn't the way we live and grow up suggest that parents are responsible for decisions about procreation? In other words, nobody tells you how many babies you're going to have. They can do things to try to suggest to you how many babies, but finally, the decisions about procreation are up to the parents. All right? Now, this decision, the real question is whether or not this decision about the life or death of the baby should be in the hands of physicians. Who's going to make the decision? A lawyer? Are you going to bring in a moral counselor and put the weight on him? The parents did get stuck with that decision. I tend to feel that I could stand with the parents and live with them through that decision and support them in it. I would not want to come down real hard on them.
I have the feeling, again, with a very brief kind of glimpse of this family that we got, that these are relatively modestly endowed young couple who would not necessarily be able to move the world in order to provide this child with what it might need. Also, incidentally, we don't know whether they have other children and what the implications would be for the quality of life of those children. Dr. Cook has suggested it might very well be an enrichment in the family, but the cost...
Can be sometimes, but I guess what you're saying is that if you're poor, your retarded children should die. If you've got adequate amount of money, why, your retarded kids can live. And I think that goes against my grain more than almost anything else, because I'm afraid this is the situation a little bit now, dramatized by this case, that there are big differences in this regard, and these seem to be pretty fundamental inequities. What bothers me most, I think, is basing all the decision on how defective an individual is going to be. Where do you draw the line at IQ 40, 50, 60, 70, 100? Because it's quite obvious if this child had had duodenal atresia, obstruction in the intestine, and was not a mongoloid baby, then everyone would have operated. The parents would have been very grateful to the surgeon for saving the baby's life, or if the baby was not wanted by the family, why, the courts would have intervened, I'm sure. And if you put all the decision on the family, then the family can take this baby home without it. Let's say it's a mongoloid without duodenal atresia, not feed it. And I think that's certainly child abuse, gets on the border of murder.
I suppose, like many of us, was most shocked that they left it as it was, that they, in a way, the medical people said this is up to the parents, which so often happens medically today. There is a feeling that I think is a part of culture that we've still got, that the parents do make these decisions.
I'm very surprised when people say that the physicians are dumping this on the parent, because legally we don't have any choice. We can't operate on a baby without an op permit being signed, and it has to be signed by a parent, or else we're in for a healthy suit. One of the last cases was
You're not more disturbed by the suit than you are the death of the child, of course. I mean, it seems to me you have to act under those kinds of circumstances. I don't
do you
think
expect
that the
the
law
physician
would
to fight the whole of society? He's going to go against the courts. He's going to go against
But you're only
what the
assuming
parents
that the
want.
courts would not have acted. And there are a number of cases in which justice has been done, even against not just the wish of these parents, which again we don't really quite understand, but they certainly didn't seem to identify it with a religious belief or some other feeling against an operative procedure. They seem to have allowed the child to die merely because they did not want to bring it up.
If people can, in a sense, harden the heart and not respond to the need of this child, I mean, this is something that I think happens all the way through our society and is really destroying us, this ability to not feel, to flatten the emotions, to call it a technical name. The patient is not going to have this operative procedure, and so forth, so that you can hide certain sort of elemental responses. And this man is emotional, and the tender animal as well as the aggressive one, who can have this tender helping response.
I would contend, though, Sidney, and I would say this to Dr. Cook, too, that simply to, with great compassion and affect, give oneself monistically to the idea that this life must be saved, is to shut off a whole range of other, not just considerations, but feelings. This is a new young life. Our unequivocal responsibility is to use whatever we have available to us in modern medical science to preserve it, to save it. And there is no other consideration, there is no other right answer, there is no other suffering involved other than that a child's life should be snuffed out prematurely. And I would contend that this is an understandable, but nevertheless a defense mechanism that physicians use and gradually perfect, because they come up against so many times anguishing problems like this, for which, as a matter of fact, there are no easy answers supplied, not only by the profession, but by the society at large.
The missing part of the film was that only the backs of the parents' heads were shown. The problem was all the doctors. I want to tell you that parents agonize in the first 3 months of pregnancy about whether or not to have an abortion with a child that by definition would be terribly genetically deformed. Having an abortion doesn't remove the problem. So that the problems of the parents in making a decision whether to end the life of the child are not simple, even when it's after prenatal diagnosis and an abortion. They suffer intensely, and they suffer for some time to come after the child is aborted. I personally don't think there is a lot of difference between the moral problems these parents faced and the moral problem of ending the life of a child who's terribly deformed in the first couple or 3 months of pregnancy. The heart-rending part was sitting there and watch the child slowly die for 15 days.
When this baby's on our service, our staff was asking, not just do we operate on this baby, but if no one lets us operate, why can't we be given some permission from some authority to terminate this life more easily, to go on for 15 days torturing the nurses, the family, and so forth? Seems to be terribly hypocritical. If we've condemned this baby to die the minute we agree not to operate. So if so, why do we prolong this tragedy for over 2 weeks?
I think there are many other situations like that to which the medical team almost stoically subjects itself without reflection. This physician, overburdened already by the moral nature of this decision, was also confronted with this.
I felt he hated these parents.
Yes, he did.
I felt that way. I don't know whether you did.
I did.
And there's something about that that cries out in him that I shouldn't have to bear all the responsibility for letting this child die and being stuck with it. Here's where what you say really comes through. He was being stuck with it.
Suppose the doctors had said, no, take the baby home. You starve it at home if you're going to do this. Now, what would have happened?
I'm not sure that really we can put our feeling of, gee, isn't it a shame the parents had to make the decision? Isn't it a shame that the medical people had to sit there and watch the baby die? I don't really think so. I think if they made that kind of a decision, they ought to suffer through it. They ought to at least suffer through the anguish of what has happened. As you say, maybe even earlier when the anguish would have been less, anguish will still be there.
What I feel that this case today is an example of a very primitive way of handling a problem.
But why are we, it seems to me we are so hypocritical. We stick a needle in the uterus at some risk to the mother, at some risk to the possibly normal baby, to make a diagnosis so we can end the pregnancy and not have an abnormal baby born. Well, if we were honest with ourselves, instead of the risk to the mother in the middle of her pregnancy, we ought to wait till the baby's born. There's no risk. He can do a blood test to determine whether or not he's a Leishmanian or a Mongoloid baby or any one of many defects with absolute certainty. And then you don't feed the infant. That's what we did in this case. We didn't feed this baby, nothing by mouth. So you let that baby die. Now somehow things are very different when that baby isn't born. So we go through a lot of maneuvers to avoid facing up to what happened in this case.
It seems to me that society continually is moving toward trying to make each individual's life an independent value, and that at least at certain stages, when people are helpless or people do not have an opportunity to exercise an independent judgment, that we try to provide mechanisms to help them to do that. And it seems to me that here, at least, we've got to take our cases one at a time. We can't generalize everything. In this one individual case, I think a great wrong was done. I think much of what is going on in our society now, today, is that you do challenge. You do challenge an op permit. You do challenge the right of a parent.
I'm sorry.
You challenge each of these factors in the interest of what you feel to be the values of life.
The pendulum shifted in the other direction. We're getting hung up constantly on whether or not we've really informed people properly before we get their consent. I mean, the movement is all in the other direction. That the doctor now really doesn't even dare take some blood from a patient without getting a permission from somebody, because the legal profession is breathing down our necks that we're doing things without informed consent.
Doctors may be concerned because they're riding on the crest of changes that men are making in themselves. These are radical changes. Human beings are actually changing themselves. And that's what we've always done, only it's in the light of day. Everybody knows it. Our problem is how we're going to live with our power to change ourselves.
out there? What's going on?
It's all right, Miss Berger. It's just me, Cassie Stooley.
Who?
Cassie Stooley. It's just me. It's just me.
That's good, Jane. I really like your commitment. But remember what I said. It doesn't have to be an animal. Okay? Okay, you, next.
Meow.
That's good, Winston. That's good. That's good. But hey, very convincing feline. Guys, listen up. This time, I don't want an animal. I just want an emotion, an abstract feeling. Okay? You next.
Ooh, that's scary. Nice song.
Still working on it. Brand new C harp.
Gosh.
Want to try it?
Okay. No.
Go ahead, try it.
No, that's all right. I gotta go. It's a nice harp, though. Thank you for letting me hold it.
Sure.
I don't know, Pat. He just keeps looking at me, staring at me with those eyes.
How do you mean exactly?
Well, it's hard to explain, see, because he